Good afternoon, everyone. I'd like to welcome you all to the Association of Pakistani Physicians of North America and our webinar with some of our esteemed local pharmacists. My name is Umair Siddiqui. I'm a family physician. I'm also the former medical director of the Copeman Healthcare Clinic here in Calgary. I have a particular area of interest in preventative health, chronic disease management, cardiovascular and endocrine medicine. With me, I have some very esteemed pharmacist colleagues, beginning with Mr. Moeen Pasha. He is a pharmacist and a principal owner at the Valerie Ridge Pharmacy in the northwest of Calgary, with an interest in travel health, additional prescribing. I've also got Mrs. Fazia Khan, a pharmacist and the manager at Elite Pharmacy in Bowness, northwest Calgary. Fazia qualified in 1997 with a bachelor's in pharmacy from Karachi University and has been practicing in Canada for the last 5 years. She also holds additional prescribing authority and is well versed in CACPs and SMMAs. She's also an ardent promoter of health and travel education, as well as Manto testing. Mrs. Khan also has an additional training in the delivery of injectable medications. Last but not least, I'd like to welcome Ms. Foster Charlong. She's a pharmacist and co-founder of the Penny Foster Pharmacy. She qualified in 2005 with her Bachelor of Science in Pharmacy from Dalhousie. Additionally, she also has a Bachelor's of Science degree in Psychology. She's worked with Novo Nordisk, one of the big 10 pharmaceutical companies globally. She holds certifications in additional prescribing, smoking cessation, travel medicine, and is also a certified diabetes educator. Welcome all of you, and thank you so much for spending some time with us on a Sunday away from your busy schedules. We're really grateful to have you here.
Thank you.
Thank you.
Thank you. Great. So, we're in an interesting time right now with the pandemic. Unlike a lot of professions where a lot of us can work from home and remotely, I think it's fair to say pharmacists don't really have that option. Well, I'd like to begin with some questions which I think our audience will find really useful, and I think it'll help get a better understanding of what's happening in the world of pharmacies right now here in Calgary, as well as understand some of the extra benefits and services you guys are able to offer right now. So my first question is, with physical distancing and the public health measures that have been put in place, we've all had to change the way we practice, be it pharmacists, physicians, or other allied healthcare professionals. Can you describe what's been the most significant adjustment you've had to make to your practice?
Okay, so thank you, Dr. Umair, for asking such an interesting question. So apart from public health measure for using personal protective equipment, hand sanitization, and social distancing, there are some changes proposed by Health Canada and Alberta College of Pharmacists, which I would like to take firstly. So the proposed changes or restriction lifted by Health Canada are prescribers can now prescribe verbally controlled substances to the pharmacist. Pharmacists can extend the prescription for controlled substances. Pharmacists can even transfer controlled prescription from one pharmacy to another pharmacy. The other thing, pharmacists are now only giving 30 days supply to manage supply chain. There is a big change, like for clozapine. I basically work with mental health patients, so there is a restriction that clozapine cannot be dispensed until patient has done their ANC, absolute neutrophil count, and WCB testing. So now this restriction has been lifted, and we are asked to continue to dispense clozapine even if patient is not able to go for their blood test. Apart from that, there is a lift in the restriction for vetting signatures when pharmacists are doing any kind of assessments to the patient. So now we are providing virtual care to the patients where we are dealing with medication adherence, side effect management, follow-ups, lifestyle modification techniques. smoking cessation, and much more. And there are some changes which are proposed by pharmacy owners, which I would like to mention, like use of glass barrier in front of the pharmacy counters and at the pickup points, proper sanitization and frequent sanitization. So these are the few steps taken.
All these things that you've mentioned, they're like so crucial. They're actually really good
Yeah,
habits to have in place. So I think we are going to see some of these additional measures when it comes to infection control. Fazia, would you say, being a frontline worker in the community right now,
definitely.
number one, do you have adequate, access to personal protective equipment to protect yourself? And what kind of scenarios as a pharmacist do you face where it may be required?
Okay, thank you, Dr. Mayer again. Yes, we are provided with personal protective equipment in adequate quantity by Alberta government, and Alberta College of Pharmacists it is mandatory to use personal protective equipment when we are in direct care of patients. And there are scenarios, as I already mentioned, that I'm working with mental health patients. So patients are calling and they are in need of their injection. So as a pharmacist, it is my job to assess which injections patients should get and which injections can be postponed. So here I would like to take an example of Shingrix. So if patient has not yet started their preventive medication injection, they can certainly postpone it. If they are on the second dose, so there is a wide range to get the second dose, which is from 2 months to 6 months. So this can safely be postponed. While on the other hand, antipsychotic injections, those cannot be postponed because it negatively impacts patients' health. So as a pharmacist, we have to do risk assessment. And once we feel safe, we can call the patient and using our personal protective equipment, hand sanitization, we prepare injection in front of the patient and we ask patient to maintain a social distance until the injection is ready to be given. Once it's been made ready and it's ready to be given, we call patient inside, we give the injection, and after giving the injection, we try to sanitize the area. This is how we are managing.
Okay, that's really really helpful. And Fazia, what advice do you have for some of your patients and clients coming to your pharmacy to reduce the risk of transmission amongst other clients and also to yourself and your staff?
By this time, most of the patients already know what practice they should do, but still I would like to emphasize on few of the most common points. Patients should maintain good social distancing, which is at least 2 meters from other patients and the pharmacy staff. This will help prevent COVID transmission and on the other hand will keep the privacy of the patient. Secondly, they should maintain good hand hygiene, which is either using alcohol-based hand sanitizers or washing hands with soap and water, keeping in mind that rubbing soap for at least 20 seconds. Use of personal protective equipments like mask and gloves should be worn when they are going to public places. Secondly, being a pharmacist, I would encourage patient to call us ahead of time if they need their medication. This will avoid overcrowding, and as pharmacy staff is very busy at this time, high demand time,
Yeah,
so we will get ample time to prepare their medication and we will allot a time where they can pick up their medication.
I think
Second, yeah,
you made a really good point. I think in an effort to call in first and let
yeah,
the pharmacist know, just avoids a whole bunch of people waiting in the pharmacy to
sure,
get their medications.
sure.
Yeah.
Secondly, I would like to add that if patients are unwell and they are coming across symptoms of COVID-19 or they are suspecting that they may have COVID-19, they can assign someone like patient's agent who can pick on their behalf. Or if they do not arrange that agent, they can call us. We can make arrangement like delivering to the patient's doorstep. If patients have any questions regarding their health, COVID-19 pharmacists are now doing assessments for them.
Okay. And Moeen, what about in your case? Are there any specific arrangements you've made? And given some of these measures are going to need to continue for a little while, what kind of arrangements do you think will continue in your particular circumstance?
Sure. Thank you, Dr. Umair, for having me here in this informative and useful session. Well, the most of the things have been mentioned by Fozia earlier. That the different things that I have done at my pharmacy is we have installed a barrier, a physical barrier on the pharmacy counters and the cash register, which is like a glass. So that provides us a physical barrier between us and the patients. And obviously, when we are talking to the patients for giving out some advice at the front store, obviously we have to go out, and we are keeping a certain distance when we are talking to the clients. Mm. So these are the major changes in terms of the physical distancing that we have implemented into our pharmacy. And I think going forward, it looks like we have to keep those barriers for I don't know how many more months until the situation gets better and we get overcome of the situation. So these are the new things that we have implemented, and we have been practicing social distancing. We have been telling people about the same thing, and yeah, so I think we have to move on to this change for a while.
Great, great. You know, everyone's having to change their practice in some way or the other. Fazia, what services have you sort of adopted in this time to ensure sort of patients get the medications that they need? Are there any sort of new services or facilities you've been able to offer?
Yes, thank you, Dr. Umair. So firstly, as proposed by Alberta College of Pharmacists to post a signage on pharmacy door that if patients are unwell or coming across any symptoms of COVID-19, they should not come to the pharmacy. So patients were very much panicked that how would they get the medication. In order to solve that problem, we are doing delivery services. Okay. If firstly we encourage that if patient cannot come, patient should send someone who can pick on their behalf. If that cannot be possible, then we are making delivery services to their doorstep, which is of no charge.
Okay. Is there like a priority, like who gets priority for deliveries and who doesn't?
So the priority is if patients cannot send anyone, like patient cannot assign any agent, then in that case, we prefer to send or deliver medication through courier service to the patient's door.
Great, thank you.
I'll just pop in on that one. We're also doing curbside delivery because we've been asked. So people still in the neighborhood can walk up and we'll just go put their stuff on the stair. And we're doing delivery of front store stuff and pharmacy stuff as well. And anybody who wants delivery, we're just doing it for them.
Great. And what kind of time frame is it when a patient says that they'd like to have medications delivered or product delivered? Is there a certain time frame they are expected to wait?
I think among us, it'll probably be very different depending on what delivery service you use. We have sort of two different cutoffs. So for our patients, it's mostly same day. Okay. And I think Moeen had mentioned, like, if it can't get there, like I've driven personally to people's houses and dropped things on their step, and so we're kind of doing everything that we can to make sure that those people are getting what they need in a timely manner.
Great. Foster, what about pharmacists and their ability to offer, virtual visits? Is that something you're able to offer, and what kind of scenarios would command pharmacists doing virtual visits?
So yes, we're absolutely doing phone calls and virtual visits. I work in two different work environments, so I've done phone calls and a lot of sort of virtual visits in the past. So that for myself hasn't changed a lot. I'm definitely doing more of them because I'm not seeing patients in clinics anymore. But a lot of those patients I'm still calling, I'm still following up with them, especially because I am a certified diabetes educator, and that's sort of where I see most of my patients, and I guess the most complicated patients. I've been sort of just monitoring and assessing those people by phone, whether or not it's weekly. You know, a lot of people aren't going to get their labs, their A1C, as it's not critical. So we're just sort of trying to manage and mitigate when they should go, at what point, you know, discussing those kind of things with the physicians as well. So if a patient calls, you know, we're kind of there to talk to them or review and virtually or by phone.
Moeen, we all know that pharmacists are only prescribing only 30 days worth of medications. Can you tell me the reason behind that?
Yeah, sure. First of all, I would say that it's a advice decision by the authorities to do that. Why? I'll take you to the scenario here. Like few months ago, when this pandemic started, so all of a sudden we were getting a high demand of refill requests for 3 months or even more than that from most of the clients, because they wanted to get most of their medications because they didn't know about the situation, what's going to happen in the future. So they wanted to get maximum supply of the medication. So, well, we dispensed 3 months supply, obviously not more than 3 months, because most of the insurance companies, they pay only maximum 3 months at a time. And obviously every pharmacy was doing the same thing across the province. And that created some shortages of the drugs. And because it was an unusual thing that just started all of a sudden. And in some cases, there were some early refills as well. I mean, people got their medications a few days ago and they wanted to get more. Mm-hmm. So what happened, the shortages started and we had some issues of getting medications, supplies. So I'm thankful to the authorities who advised us to limit the day supply to a maximum of 30 days. And since that change was implemented, we are not facing that kind of problem of drug shortages. And that has managed the drug supply. Yeah. And on the top of that, the suppliers, what they have done, they put some filters on the orders. So for example, if let's say if I order 5 bottles of something, they would supply us only 1.
Okay.
And they have done their part as well to control the shortages so that every Albertan can get their meds. So I think, and we have to acknowledge that this is just a temporary change. It's not going to be forever. Mm-hmm. And a lot of my clients, they are very, very cooperative in this regard, and they do understand why this change has been done. Mm-hmm. And they are very cooperative. And I didn't get any complaints that why we have been giving them 30-day supply. In the beginning, they asked the questions. Obviously, they wanted to know why it happened. So when we explained them, and they understand. So I think it was a very good step, and that resolved a lot of problems with the drug shortages.
Okay. Fazia, are there any medications that you're aware that are currently facing a supply issue or an actual shortage that you're aware of?
At this time, I would say, like, if you specifically talk about inhalers, so inhalers at this point, they are available, but sometimes patients, they want the brand, like say, for example, brand Ventolin. So brand Ventolin, at this point, it is not available. We can make them understand that generic version is available, which can help them the same way. And secondly, at the supplier side, we have an option to put notifications. So whenever the product is available, we get a prompt.
Okay.
Mm-hmm.
Moeen, several patients have voiced concern about this whole 30-day prescription and having to repeatedly pay prescription charges. Is there any truth to this, or what's the story around having to pay increased prescription charges because of the frequency of prescriptions?
Right. So basically, first of all, we have to acknowledge that this change was implemented, I think, maybe more or less 1 month now, not more than that. And people are basically anticipating that this change will be, going on for how many months, they don't know. So that's where they have these concerns right now. But as I mentioned earlier, like I can answer whatever I'm dealing with my clients at my pharmacy, that only a few people had concerns about the 30-day supplies. And then when we explained them why this change has been implemented, and the drug shortages were happening, and then we are not facing that problem anymore. So they do understand the situation, and they have been very cooperative. I mean, there could be chances that at other pharmacies, I mean, I'm pretty sure it's going to be very less number of people having those concerns, because majority of the people, they know what's going on. Mm-hmm. And these measures are to control the drug shortages, and so every Albertan can have their medications. So I mean, my clients, I didn't have any big issues with that, and they understand, and then they've been very cooperative.
Okay.
I just want to pop in one. So Blue Cross decreased the fees for the patient. So over the 3-month period, they would not be paying more than what they would if they were filling one time. So anybody with Blue Cross, whether it's seniors, whether or not it was social services, even private Blue Cross payers, Alberta actually took that step, which was great, because there are a lot of other provinces that actually didn't take that step. Yeah. Some of the other insurances, unfortunately, aren't doing the same. So yeah, but Alberta Blue Cross did do that, which is great for Albertans.
I agree. I think from a patient perspective, if you can balance out those payments, like you say, it only makes sense. Are there any other subsidies, Moeen, that you're aware of, or temporary benefits that drug insurance companies are offering to their members?
Yeah, so basically, as Foster said, that Blue Cross, which is a senior Blue Cross, and a non-group Blue Cross, which is a group 1, has already implemented those subsidies for their plan members. That I mean, the maximum co-payment before the situation was $25. Now they have reduced this co-payment to $8. So basically, for example, if someone was getting a 3-month supply and that person was paying $25 as a copay, now because you're getting your meds on a monthly basis, so they pay $8 per month. So if we calculate it, they end up paying $24 for 3 months, which is even $1 less than what they were paying before. So so we really appreciate this this to the Blue Cross, that they have done this for the plan members. And some people, they still don't know about this change that Blue Cross has done for them. So we explain them that they don't need to pay extra, and they are paying a reduced co-payments for their meds, and then they understand, and then they appreciate that change. When it comes to the other insurance companies, no, I haven't seen any changes yet in that regard. Maybe they will come up and do something for that as well. But I have seen a change that some insurance companies were allowing to get a 3-month supply previously, rather than doing less than 3 months. They are accommodating a 30-day supply as now to their plan members. Yeah.
Thank you, Moeen. Foster, you being a certified diabetes educator would require, working collaboratively with the patient's primary care team, the family health nurse, the family physician. What are the ways that you can think of where you are collaborating to maintain that continuity of care for your mutual patients?
So pretty much any time I speak to any of my patients, whether it's sort of the patients I see with the physicians in those clinics or even outside, I'm just always sending notes off to their primary care physician. Want to keep them in the loop, especially if there's any concerns that have come up, if there's any changes that may need to be made. sort of getting everybody's thoughts and working, you know, together, because that's how we've always worked with those patients. So right now that's not changing. So it's just more or less communication either through the EMR system, through, you know, faxing the doctors. So I do feel the way I've continued to practice has allowed that continuity of care for our mutual patients, which has been great.
Great. You know, there's been lots of conflicting information, studies, publications, which either conclude or sort of refute ACE inhibitors and ARBs to a lesser degree to be associated with a worse outcome in COVID-19. What is what do you know of this? What is the official position of your college with respect to these two classes of medications? I mean, are they safe to continue using during this pandemic?
So based on what the Alberta College of Pharmacists is sending out, as well as our association, which is RXA, their position is that there's no evidence or not enough evidence to suggest that anybody should be stopping those medications, especially that most people are on those medications for a very good reason. And if they stop them, there can be more ramifications than staying on them. So at this point, there's nowhere that it says that we should be changing or, you know, any concerns with the patient staying on them.
Have you personally come across any patients with COVID-19 that went into the hospital, you know, with respiratory complications, and hospitals have sort of taken them off the ACE inhibitor or taken them off the ARB on discharge? Have you seen any of that yet?
No, I actually haven't.
Okay, great. And the same thing about anti-inflammatories. There was a lot of hoo-ha over you know, ibuprofen, Aleve, and all sort of non-steroidal anti-inflammatory drugs. What's your view on that?
So again, the same. I think any position statements I've read or that have been sent to us through communication has stated that there's not enough information, again, to tell people not to take it, especially like aspirin that people are on, again, for secondary prevention, for cardiovascular, that they should remain on them. And if there are concerns, then I think the best thing as a pharmacist is to really direct them, you know, back to their primary care physician, back to their specialist, but not to stop it.
And, you know, as a primary care physician and having a number of patients on, you know, immune suppressive drugs like methotrexate and Humira and Symphony, etc. What are you telling your patients who are currently on these, you know, immune suppressing drugs or biologics when they ask you that question?
So interestingly, I actually haven't been asked that question yet, but if I was to be asked, I'd tell them, you know, to continue. Again, if there's major concerns, then speak to the specialists that have prescribed them. But at this time, those patients are already at a higher risk of COVID and any complications because they're immunocompromised. And most likely, if they stop that medication cold turkey, they would be at a high risk of flare for whatever disease they're actually treating, which could put them in a much higher risk of getting COVID. And so at this time, it just would make sense to tell them to continue. And if they do really have concerns and have, you know, specific questions about that, then I would direct them back to the specialist that is, you know, prescribed, like the rheumatologist or, you know, the dermatologist.
And I agree with you. I think that's what primary care physicians are telling their cohort of patients who are on these drugs, that if you are well, you continue them. And in the event, you know, you contract the virus, well, then in those circumstances, you may want to consult your rheumatologist and probably stop only the immune suppressing drugs. You know, what about your scope of practice? Have you seen any extension in your scope of practice due to the pandemic in any way? And if so, how?
Well, in Alberta, we're actually very, very lucky. We actually have the most extended scope of practice, probably some of the best in the world. So as pharmacists, we, with additional prescribing specifically, we do, and you can practice pretty extensively. So personally, I haven't found that I've extended anything. I definitely am doing more of those, maybe more adaptations, maybe more refills, or, you know, initial prescribing, you know, if the doctor's not in on the Friday. But what's interesting is there are a lot of patients that actually don't realize what the physicians are doing, like that they're doing virtual telehealth conferences, that they're still at the offices, that they're still taking phone calls. And so I'm trying to help those patients, you know, sort of navigate that healthcare system, knowing that, you know, those physicians are there. They want to talk to you. They want to see how you're doing, you know, give them a call. You know, same with sending patients to the ER. A lot of people don't want to go to the ER if they don't, or if they're afraid but if you're having chest pain and shortness of breath, well, it's better to go to the ER and get checked out versus going home and just, you know, waiting. So I find that I'm doing a lot of that as well. And then just the same, like we can, if your pharmacy is able to do injections, then, you know, we can go ahead. There are pharmacies that aren't and don't have the personal protective gear. And so they do have to let their patients know where they can go. So there's lots of different things that we can do, but I am trying to, you know, like I said, direct the patient into the right direction. But if it's a Friday afternoon, the doctor's gone, it's the weekend, then, you know, I do feel like I'm doing more of that kind of thing.
Great. You know, one thing that I've noticed during this, you know, pandemic period, and as my practices changed, you know, ordinarily docs would be very, you know, everyone's busy, but, you know, you don't make enough time for communication with your colleagues outside of your clinic, like, you know, pharmacists, physiotherapists, chiropractors, and whatnot. But one thing I've really noticed over the last 6 to 7 weeks is the communication between family doctors and pharmacists has just suddenly improved significantly. And I really hope that going forward, once, you know, this pandemic is brought under control, that level of communication and collaboration just continues. That's great. Moeen, are pharmacists currently involved in COVID screening or assessments in any way? Are you guys doing like nasopharyngeal swabs or throat swabs?
Are involved in doing the assessment for the COVID-19 for the public. But we are not doing any nasopharyngeal testing. So the testing is being done by the other department that so the people have to call 811 and then they get the referrals for the testing. So what we have been doing, we are creating an awareness to the public about the symptoms of the COVID-19 and all other information they may need. So what we have been doing at our pharmacy, that we are asking almost every patient that if they have any questions about the COVID-19, and we can help them with that. And the most common questions that we get from the public about this is, what are the symptoms of COVID-19 and are you doing any testing? So basically, we are not doing any testing, or we're doing the assessment. Now, there is a tool which is called self-assessment tool that some people were reluctant to give it all the information in the beginning. I mean, you know, about those symptoms and all those things. So I think it's a good thing that there is a self-assessment tool available on the Alberta Health website that, I mean, we have been telling to the public that there is a self-assessment tool available on their website, and they can log into the website and then they can do their own assessment, especially if they're having any kind of symptoms. And that tool tells them what to do next. So it tells them whether to call 811, if there's any need to call 811, and they call 811 and they will be referred for the testing. So yes, we have been helping a lot of people with this regard, that the assessment for the COVID-19, and a lot of people, they are being benefited from this information, and we have been giving them other informative information which is posted on the Alberta Health website regarding social distancing. There are some videos and hand hygiene techniques, and update on the COVID-19. So yes, we have been doing all those things except the testing.
Thank you, Moeen. Thank you, Fawzia, and thank you, Fosta. There's no way to say this, but you guys are truly frontline healthcare workers that are trying to keep patients safe. You're working immensely hard, and you're collaborating with specialists, family doctors, just maintaining the flow of care. And there's no other way to say this, but a huge thank you for the hard work that you guys are doing on a daily basis. Moeen, I'm going to give you a moment to just give me a bit of a conclusion. We talked about saying something as we wrapped up.
So the conclusion is that every healthcare professional is doing their job very efficiently in this difficult time. Doctors are doing their part very efficiently. All other healthcare professionals, nurses, and all the other staff is doing very well. So we as a pharmacist, we have been doing maximum what we can do for the public. So we are keeping our doors open for the public. We are not working from home. We are working from our pharmacies the way we were doing before. Though there is a risk, so we are using all the PPEs and all the SOPs to protect ourselves and to protect the public. So we are always available for the public. Whenever they call us, whatever the questions they have over the phone, whether they're our customers or not, we get several phone calls on a daily basis from customers who never came to our pharmacies. They're going to other pharmacies, but they had several questions about different ailments, about front store, about OTCs, any other recommendations. So we are helping them. And when it comes to the delivery, so basically what's happening, a lot of people, they are self-isolating and they can't come out. And some people, they are reluctant to come to the pharmacies because they don't feel comfortable coming to the pharmacies right now. So what we have been doing, first of all, there is a cutoff time for the couriers to send out the medications. So if someone calls before that cutoff time, we send out the medications to them through the courier, and there is no fee for the public for that. So this is a free service. So we pay to the courier, but we don't charge to the patients, right? And number two, if someone calls after that cutoff time where we cannot ask the courier to deliver the medication the same day, I personally, after I close the pharmacy, I personally go to the doorstep of my patients and deliver that medications to them.
Guys, your commitment and your dedication to care is not going unnoticed, and you guys truly embody the term frontline health workers. I want to thank you all for your time today, for contributing to UPNA's webinar on this Sunday. I wish all of you keep safe, remain healthy, and look forward to things calming down. Many thanks once again. So I'd like to thank all of you who have tuned into today's webinar with an extremely important faction of the healthcare fraternity, and that is our pharmacist colleagues. As you're aware, they were truly frontline workers that have not shut their door during this pandemic. Their role is crucial, and none of physicians, non-physicians would not be able to do what they're doing without the support of these crucial healthcare workers. I really hope that you found some of their opinions and the answers to their questions useful. This pandemic is teaching us so many different new scopes of our practice. Hopefully we'll carry some of these extended scopes with us once things calm down. Once again, it's Omer Siddiqui here at your service from UPNA Alberta chapter, wishing you a very prosperous and safe week ahead.